And at age 95, women outnumber men 8-1, which is good for the one guy. But so really, one of the first questions that we wanted to ask with this men's health initiative is, can we explain why there's this gap in the average life expectancy between men and women? And it's a little bit like a murder mystery. You know, what's happening here? What's going on? Why is this happening? So we commissioned a report which reviewed a lot of statistics, a lot of literature, and we came up with a roadmap to men's health, which is about a 150-page document. And I'm going to summarize it very quickly. We developed a framework to look at men's health, and there's male-specific conditions. Clearly, there are things that happen to men that can't happen to women, having to do with the prostate or the penis or the testicles or testosterone levels. Clearly, those are male domain specific, but there are also male risk conditions which you may not have been aware of, things like osteoporosis in men. It's thought of as a women's disease. Cardiovascular disease, suicide, as I mentioned earlier, much more prevalent in men. And I'll just get to show you some of that data in a moment. So some of the reasons why we think that there may be differences between men and women in life expectancy and health expectancy have to do with their biology. Men are hardwired differently. We think differently, we're physically different, our brain structure is different, and that might be one of the reasons. We have different hormones flowing through our blood streams. There may be environmental factors, and because we're stronger, we take on the riskier jobs. And that's not a negative. We have to. Somebody has to be the fireman, and somebody has to be the sailor or whatever. We take on the riskier jobs because we are the stronger sex, if you will. But we can't blame the victim. And men tend to seek out less social support, which is a problem from an emotional and social point of view. And then behavioral factors. We take risks. Young men take risks. They drive fast. They do silly things. And that may be a reflection of the traditional masculine role. It may go back hundreds or thousands of years to when we were hunters and gatherers, and that's just the way our brains are tuned in. But I say to you, having a Y chromosome, which you know is the male chromosome, should not be seen as possessing a self-destruct mechanism. Okay? We can change behaviors. We shouldn't blame the victim. Just because, you're dying just because you're a man, because you have a Y chromosome. You don't blame the victim. And you don't undervalue good, strong, positive male traits. Like I said, somebody has to put out the fires or be the police or whatever. And there are women out joining those forces, of course, but traditionally, the dangerous jobs are male jobs. So we don't want to undervalue these traits, which in the same time will feed back and cause men to die at an earlier age. And we don't want to alienate men in whom we seek to instill these healthier behaviors. Now, sometimes men are just stupid, as you can see here. And if you look at that carefully, you can see why some men die earlier than women. Okay? But the statistics are really eye-openers. So looking at cardiovascular disease, and these are British Columbia numbers, okay, strikes men more often and earlier. So if you look at these curves, on the bottom you can see the different age groups going from left to right, getting older. The red is women and the blue is men, and the gap starts to spread at around age 40, where men are dying earlier than women. Women still have heart attacks, women still have cardiovascular problems, but men are dying. So why are they dying when women don't die of the heart disease in those ages? And it may be estrogen, it may be different habits, food habits, eating habits, anger management, other things. A good area that needs to be researched. Look at the gap here between suicide, in the blue being men and the red being women. Again, women attempt suicide more often, but men are more successful. They use lethal methods. Men don't like to talk about it. Once they've decided, they do it. They hang themselves or they take a gun to their head, and that's it, done. And you can see that the big gap here in the 20s and 30s, and then there's a secondary gap later on in men in their 70s and 80s. Okay, so this is a significant gap. And so if men are dying in their 30s and 40s, mathematically that brings down the average life expectancy. Because a lot of men live to the 80s and 90s, all right? So not everybody's going to die at age 76. It's an average. Motor vehicle accidents, again, you can see the gap in the early years in the 18 to 30 range. And alcohol abuse. Mortality from alcohol is 6 times higher for men than women. Now, a lot of women drink a lot too, but men tend to drink more. They tend to develop liver disease and die as a consequence of alcohol abuse. So I put to you that there is a need for a men's health initiative. We rolled out in November 2009 at Vancouver General Hospital. We see it as a British Columbia initiative. It's an umbrella. We are all trying to identify the areas and the foci of excellence around the province. There are a lot of good people in the healthcare sector, not just MDs, a lot of nurses, psychologists, and so forth, who have an interest and an expertise in an area or more than one area of men's health. We're trying to bring them all together under the mandate of consolidating and coordinating, and I use the C's. I played with the C letter here, in comprehensive research, communication, but perhaps the most important is community outreach. And it's not just holding public forums, which are important like this tonight, but getting out to the men who don't go to see a doctor for whatever reason, can't see a doctor because the healthcare system isn't friendly to men who work long hours during the week, and then there's doctors' offices are closed on Saturdays and Sundays. So we want to reach out to men and get the information to them as to how to assess themselves. What am I at risk for? Am I at risk? What can I do to prevent illness? What can I do to narrow that gap between health and life expectancy in my own situation? And we're doing it through a variety of communications and networking ways. Here's our website, aboutmen.ca. It's a growing website. It'll be populated more and more every day, but I think it's a good website, and again, it's our way of reaching out, public forums like this one here tonight. And ultimately, we're hoping to advocate for policy change at all government levels, where governments will recognize the importance of male health and institute public policies that are more male-friendly and address some of those issues that I showed you from our report that are impacting on men and causing them to die at an earlier age. Fraser said, "Men don't use sex to get what we want. Sex is what we want." Sex is how we're going to get men into the system. That's one way to get a man's attention. So it's the portal. How are we going to get men to start to think about themselves? And it's amazing, and Dr. Elliott is going to bring you up to speed on this in just a moment, about the portals. How do that sexual ill health can really bring men in because it's maybe a reflection of other problems in the man. Groucho Marx said, "I'm going to Iowa for an award. Then I'm appearing at Carnegie Hall. It's sold out. Then I'm sailing to France to be honored by the French government. I'd give it all up for one erection." And there's no age limit to sexual function either. Sorry, I hope that's not too. These are the mild cartoons. If you want to see the real risky ones, I'll get to them later. What underlies men, what differentiates us and what it really is the common denominator to all male health issues is testosterone. It's a powerful steroid that flows through our bloodstream. That's a picture of Dr. Carter just a few years ago. Testosterone impacts on libido and sexual function. This cartoon, you can see the young lady on the left, and the woman is saying, "I know you want to look. Don't turn your head. You're a dead man if you look." And he's thinking, "Somebody kill me." Testosterone levels impact on cognitive function, on your brain. It's important to know that as your testosterone levels drop, changes happen in your brain. Depression, memory loss, and so forth. Testosterone is one of the reasons for male aggression and male stupidity. It impacts on our fat distribution and on our muscle development. Testosterone is a very, very important hormone in bone health, and I mentioned earlier osteoporosis. So when we lose our testosterone as we age, what we now call late onset hypogonadism, used to be called andropause, like menopause in men, it's now called hypogonadism, meaning you're not making enough testosterone from your gonads.